Hello, everyone. My name is Solome Tibabu. I'm the host of the Going Digital Behavioral Health Tech Conference. I'm so pleased to be joined with Dr. DuBois from Mindstrong and Dr. Parsons from Humana. Super excited for this conversation. Why don't we get started with a couple introductions? If you could share a little bit about your background, starting with Dr. DuBois.
Sure. Yeah, I'd love to. So I am a psychiatrist by training, an adult board certified psychiatrist who has been practicing solely in the field of telemedicine for the last, over 10 years now. So long before COVID, when it was a little bit rare and there was less, it was a little more cool maybe, but was really intrigued by its ability to reach people truly in need. Living in South Texas, I just saw a critical access problem. So started a telemedicine group about 5 years ago and have been working through various counties and communities here. And then most recently in a leadership role at Mindstrong, which has been tremendous because it's a telehealth venture and then some that I'm excited to share, but have known Dr. Parsons through some outside Humana work and now through this partnership, and I'm happy to be here.
Dr. Parsons, if you can introduce.
All right, and yep, I'm Taft Parsons. I'm the Enterprise Medical Director for Behavioral Health for Humana. I have been with the company for about 3 years. Prior to joining Humana, I was with Molina Healthcare for several years as their VP of Behavioral Health and also as the CMO for their Michigan Health Plan. And before that, I was both a practicing psychiatrist as well as an administrative physician for Henry Ford Health System up here in Detroit, which is where I've lived since 2001.
For those who aren't familiar, Dr. DuBois, can you share a little bit more about what Mindstrong does?
Yes. Mindstrong is steeped in years and years of neuroscience and research, really born out of the belief that we must find and that there are better tools in behavioral health and specifically in measurement science. Years prior when the concept was born, we didn't have our health service organization that's actually live people delivering care, but that kernel of truth still stands. Mindstrong firmly believes that we can build a system that provides virtual first healthcare with advanced digital tools. So that means passive and active measurements of how our members or patients rather are doing. We're excited to advance in that way. We know that access is the first step, and beyond that, we've got to be innovative around how we measure and how we approach and deliver care overall in behavioral health, because it's just been so laggy, for lack of a better word, behind some of our physical health partners. So that's what Mindstrong is doing, grown a lot in the last couple of years, have a live operating health service side and operating in 12 states.
Dr. Parsons, if you could share more about Humana's behavioral health services.
Yeah, so just a little bit about Humana overall. We're a national insurer. The vast majority of our members are Medicare members, although we do also do commercial and Medicaid lines of business, and we also have a contract to serve our servicemen and women through TRICARE. We have many challenges with serving the behavioral health needs of our membership. We know that, especially in the Medicare line of business, about 2 out of every 5 members have a significant behavioral health need. Layer that on top of a lot of the kind of well-known challenges to access for behavioral health services, but actually Humana over-indexes into our membership living in counties that don't have any behavioral health provider at all working in that county. So we really have some challenges with kind of getting our membership the care that we know that they need. And so looking to solve that, knowing that there are not enough providers kind of close to our membership, we are looking into digital solutions. We are looking into telebehavioral health solutions, to help bridge that gap to access and better coordination of the behavioral health care that our membership needs.
Dr. Parsons, can you expand a little bit more about the challenge that Mindstrong is helping Humana with?
Yeah, so we have looked at a lot of the trends in relation to behavioral health in the U.S. Going forward, and one of the things that we've noted is that by 2030, there's expected to be a shortage of about 40% of providers to meet the demands that folks have for getting behavioral health care. It's not a unique challenge to Humana. It's something that everybody is facing. And so we already know that there's just simply not going to be enough people to deliver the services that the country needs. And so, in looking for ways to solve some of those problems and get folks the care that they need, we are getting to an interesting point in medicine generally, and in behavioral health specifically, where we can actually leverage a lot of technology and a lot of new technologies that are coming out. So, talking about just kind of standard telebehavioral health, I mean, that's only one small facet of the digital health solutions that are available, and it still requires a person to see a person. And so if part of the problem that you have is that there's just not going to be enough people to do all of that care, you have to look to other ways to solve that problem and crack that nut.
And Dr. DuBois, can you talk a little bit more about what is the delivery model? How does it work?
Yeah, and that really makes sense to me, what Dr. Parsons was saying about, we only have so many one-on-one encounters at the ready. And, while moreover, right, and we also believe that there's other ways that not only could we interact with our patients, even those with a really significant behavioral health problem, there's other ways that they would prefer interact with us, or that they have time and means to do. And so that's where it gets super interesting, for me, who had, been practicing in this telebehavioral model, which, yes, was solving just that first layer of the problem, like Dr. Parsons speaks of. So in Mindstrong, when you enroll in Mindstrong, we really think of it as a 360 solution for anybody with any mental illness, essentially. And we've been working with our Humana members specifically under a certain number of diagnoses. But beyond that, what we see is that we can actually approach probably every problem of, along the gamut of mental health concerns. We have a team of primarily clinical specialists or therapists. The majority are licensed clinical social workers who initially in our early days were serving as our primary touch point, still are in most places. We also have care partners who are specialty trained, bachelor's level individuals who really have become what we call them our care partners. And either when a member has achieved, completed a course of therapy, or is in that maintenance stage on one of their mental health problems, can kind of take over and start working on all of those other concerns that accompany somebody with a mental health concern. So all the social determinants, issues around care coordination, things like that. And then we have some members who aren't quite ready, who are in that like contemplative stage of getting ready to work on one of their more serious behavioral health concerns. And we use our care partners to help with motivation, just completing that like stepped care vision that, you might see in a hospital setting, but is, I think, pretty rare and exciting to see in a virtual first model. Of course, we have our psychiatric providers, so psychiatrists, nurse practitioners, who can provide the medication management services, consultation. We're meeting, not only is Mindstrong Health meeting regularly, we meet, as a team, of course, the company's, small and tight knit around with the tech team. So there's that constant feedback between the clinical team and the tech team around, hey, how could we make our product better? How could we deliver service more efficiently? This is what our members need. So that's how it's kind of churning day to day. But our members have access to all of those care types 24/7.
That sounds super exciting. Thanks for describing it a bit more. And Dr. Parsons, can you talk a little bit about the enrollees in the program?
Yeah, so one of the things that we've found, and kind of as we set up the program with Mindstrong, we had to figure out, well, who is this best going to serve? And so, we came up with criteria, that really looked at folks that, have the qualifying mental illness, but also in particular, folks that seem to have a need. They may be using services inefficiently, having some trouble getting into outpatient appointments, ending up in the emergency room, the inpatient setting. They may have comorbid illnesses that are also affecting both the management of their behavioral health condition, but vice versa, the behavioral health condition also affects the management of their physical health condition. The average age of the folks that we decided qualify for enrollment, it actually ended up being on the young side for a company that specialized in Medicare. So it ended up being around 57, which really shows that we have a group of folks that are in Medicare, not simply because they've aged in, but because they have Medicare due to a disability. Many times that disability is the mental illness itself. And so this is a group of folks that really have high needs as it relates to mental illness, very often have multiple comorbid physical conditions, and really were not being served in the manner in which they really were able to benefit from the services provided. Just to riff a little bit on the experience that folks have is one of the things that we know is that mental health practitioners are very passionate about serving patients and doing the good work. They're mission driven and work really hard to do the right thing. The unfortunate part is that the experience of the mental health care system by most patients is not one that is very satisfying as a customer of those services, and really looking towards not only ways to get people the actual kind of clinical care that they need, but also to get them the care that they need in a way that is convenient and satisfying for them as a patient is also very important. And I think that some of these programs, in Mindstrong's platform and app and program in particular, really do help us to serve folks in a way that is pleasing to them.
That's awesome. Dr. DuBois, can you talk a little bit about what are some of the metrics that you're using in evaluating the partnership success?
Yeah, I appreciate that. And just to piggyback on what Dr. Parsons said, I think is so true, is that provider experience. So, in the tech world, you talk about, right, like a member's net promoter score, NPS. It's actually really relevant here because it means that if you are enjoying the process of getting your mental health care and you would recommend it to someone else, that's pretty significant. It's not always a pleasurable experience. It's something most people avoid with serious mental illnesses. So if we can engage people well, so that's of course one thing we look at, how long can we engage folks and who are those who are best engaged with us? That to us is a metric of success. We're looking at their overall health outcomes. So there's some world standards like Healthy Days that we've been tracking and we're excited about. We're looking at their functional status, their scores. We're using some new tools where that's concerned too that I'm excited about. But really, if you can, for us, engagement almost equals outcomes in this land, and so that's where we're kind of like digging in the most deeply. Of course, cost savings we think is going to come at the end of that, right? And so we can't predict that or even necessarily have a window into that right now. But we're going to just assume, right, that if we're doing this well enough, I can't imagine that it's not gonna get there.
Great.
Yeah. So I'll just add a little bit to that. One of the kind of difficulties, in behavioral health and for a payer, is that the amount of time that it actually takes for behavioral health interventions, very good evidence-based, measurement-based interventions to really provide those ultimate outcomes of improvements in either behavioral health, physical health, cost and utilization, those things that we look at as an insurer. It takes a long time to get there. Most of our interventions, we don't really see it until at least 18 months in. Very often it's 24 plus months before we really know, did we actually achieve those outcomes that we were looking for? And so, as we set up this pilot with Mindstrong, along with, as a company, how we kind of set up other behavioral health pilots is we look at kind of these leading and process indicators, to really tell us that we're on the right track, while we kind of wait to hit the magic number of how many folks we have to have enrolled and complete the program before we can actually do the analytics. And so, looking at things like, how often is a member using the app and getting that experience? How often are they attending, if they're getting the actual clinical care? How often are they attending those appointments? Can we tell that they're taking the medications that they've been prescribed? Those are the things that we look at as leading indicators to say that later on, once we do the final analytics, are we really going to achieve the outcomes? And I know that we've been, very encouraged by the, in particular, how often or how frequently and how much our members that are enrolled in the Mindstrong program actually are using the app itself. There's always a question with any app-based solution, are people actually going to use it? It can be the best technology and the most evidence-based intervention, but if people don't like the experience and they don't use it, it might as well not be there. The other challenge, I think, for us in particular is that, Humana kind of focusing on the Medicare population, people always get a little leery about whether or not our membership is going to engage in technology and technological solutions. And so I think that, we have been pleased with the amount of use that our folks enrolled in Mindstrong have been demonstrating. But, it's also, in a larger sense, it's not something that companies and practitioners should shy away from. I think we underestimate our seniors' ability to actually use technology. It's really just we have to pay attention to their preference and how they like to use it to give them the best experience.
Yeah. I agree 100%. And it's, so I can see it, at the micro level, because I have Humana members. I see, I still treat people within the app, and I have for 2 years. So I've seen it micro level and then macro level and how it moves. And that's exactly right. I think if we're just moving with them, then it works really well.
That's really helpful. And I know there are a lot of plans and startups figuring out how to approach partnerships in the audience. So really exciting to hear how you're working together. So thanks for sharing that. On that note, can you talk a little bit about what practically rolling out a program looks like?
Anytime we are looking at starting a new program, the first question is, what problem are we solving and what are we really addressing? If you don't have a defined problem, your program probably is not going to be successful. Once you kind of figure out what is the problem you're solving, you look into, be it how we found Mindstrong in the vendor space, and you work with companies that say, hey, we have a solution to what you're looking at. It may be a solution for SMI. A lot of companies are really addressing the mild behavioral health illness in this space. And then kind of defining what is the outline of the program, what does success look like? I think really one of the big things to pay attention to, like I said, there's it takes a long time to get to some of those final outcomes, so kind of structuring, looking at process indicators and leading indicators to kind of say, hey, are we on the right track or do we need to change something, is very important. Making sure that you select the right, for us members, for other folks, it may be patients, to go into a program. If it's not a good match and a good fit for the problems that they have, it's not going to be a good solution and it's not going to be successful. And finally, kind of having those periodic touch base, joint operating committee meetings where you're going over kind of progress to date, where you're troubleshooting things that may be happening. I think the best laid plans, can probably take care of 80% of everything that you can expect. That other 20%, you're going to have to deal with it on the fly. Small adjustments need to be made. And make sure that you kind of know how many folks you have to get in and through a program in order to really be able to tell, was this program successful? I think, I've seen some other pilots that we've done where that planning was not as careful up front, and it really interfered with us kind of figuring out at the end, the results. Like, did it actually work? Did we get that return on investment that we made?
Yeah. Yeah, and I would say that those frequent touch points and then flexibility. So, rolling out a national program in the midst of the pandemic was not easy, of course. I think, kudos to, I think, what you described previously, Dr. Parsons, around just the mission-driven nature of clinicians at large. That really, without it, there's no way that we could have accomplished this, because it took a lot of flexibility and hard work. And, it's actually, it's a very attractive, as a clinician, to be on the front of change. You don't usually get that option. And so I think if you're really honest about, with change comes hard work and flexibility, and a whole lot of reward, and you get the right team, and it really works. But I know our partnerships team has just worked so very closely with our Humana counterparts. And, without that, you can't take anything for granted. And one of us won't succeed without the other. So it has to be a really collaborative arrangement from the beginning.
Dr. DuBois, can you talk a little bit more about, is it more challenging to engage, especially digitally, patient populations who are struggling with SMI versus mild mental illness?
It can be, but at the end of the day, I think it's about an individual. And I think, right, like to everything we've expressed around just this access problem, people who are in pain essentially want help. And if you can really, if you can be, always like patient forward in that regard, or member forward rather, it's not. And I think our solution, because it offers, right, text, phone, video, and of course there's legal requirements around video and things like that in certain states and settings and provider type. But otherwise, if we can be flexible and we can make that experience as appealing, I have not found that to be true. I think that sort of an antiquated idea around, if someone's very psychotic or paranoid, that they somehow would be paranoid of the phone, using their phone for treatment. Once you get one human touch point in there, I really, to me, our full wait, our waiting rooms that are, busting at the seams of the community clinics, those are more intimidating, I think, overall, and less of a favorable experience. So we haven't found that to be true. We really haven't.
Yeah, I think, as you mentioned, the question of, would folks, particularly folks that have psychosis and possibly paranoia, would they be accepting of an app on the phone? And that was a concern that we had at first, but it has not seemed to be an obstacle. So Mindstrong does seem to have the secret sauce with getting people to allow the app to be placed on the phone, and then they also, there's kind of a passive monitoring that they do, but they also very actively actually use the app. So I think one of the things that we talk about is the stickiness of the app. And so is it something that folks really like to interact with? And I think that that's kind of another facet. And you can't have one without the other. Folks may want to interact with an app, but if that passive component isn't there, you're not going to catch some of the folks who may be in a crisis and unable to reach out due to their illness. But also, and vice versa, not everybody who feels a crisis coming on is going to show passively, and they may need to reach out at certain points. And so I think, the Mindstrong app kind of captures both of those, and they seem to work very well together to provide a very good experience for folks.
Yeah, I can expand on that a bit. We do have, our internal data machine essentially alerts our clinicians when we believe there's a possibility that a member isn't doing well, or that their score essentially has changed at all. And of course, that's only going to get better with time as there's more and more data and more touch points. The machines get more and more accurate, right? Or the models. And, you know, even what we found, right, and that's, we've done a lot of work internally on this data, is that even if the member says, no, actually I'm doing well, but that in and of itself, I'm so very glad that you reached out, or knowing, you know, knowing that this is here, that this support is here. It's like this perpetual guardrails, I think is providing a lot of unseen support.
Wow, this seems like a really novel and exciting partnership. Just your approach is not something I've seen often, and I'm really excited to hear more about it. And speaking of novel and exciting, I'd love to hear both of your perspectives on where is the future of behavioral health going. Dr. DuBois, maybe we'll start with you.
Yeah, you know, I think just, again, that idea of passive measurement, and I don't, you know, it doesn't need to be any more fancy, right? For some people than, right, like our Apple Watch, like everyone has something like that is measuring them at all times. And we've not yet, you know, if we can crack that code for behavioral health, I mean, that's magical. Because I mean, even prescribing medicines every day, it's, you try to avoid it when you can, right? Like these are not non-complicated medicines or regimens that we give to people and that we ask them to take for their whole life. And so if we can get to a point of preventive care and intervention, I think we will, right? And I think that technology is going to be the racehorse there at the end, but this is kind of just the beginning.
Yeah, I'll say, you know, if we will see more and more kind of leveraging of digital and technological solutions to deliver that human touch that people really do need. And so it's really around kind of getting, you know, the right care to folks at the right time in the right place. And I think using the technological advances as a tool in order to do that will help us to do it much more efficiently than we are as a system right now, so that we can really make a dent in that gap that we have between providers and the needs of the community. I'm excited to be kind of part of healthcare right now. I think that we are on the verge of doing some really fantastic things, and I think that you know, the country and community and as a whole are really going to benefit from the advances that we're making now in these early stages.
Agreed.
Well, I've so many more things I would love to ask both of you, but I know we're out of time, and really grateful for sharing more about your exciting partnership and more about Mindstrong, and excited to drive attendees to your booth and learn more. Thank you, Dr. DuBois and Dr. Parsons, for your time.